So I'm so pleased to participate in this conversation open to our HMA, reviewing the results of the legislative session on this last day, the last day of the Hawaii State Legislature that will be adjourning for the year. I'm Dr. Elizabeth Ann Ignacio, and as Mark said, I'm joined by our knowledgeable government activist and legislative expert, Linda Rosehill. Our legislative committee brings together a diverse group of Hawaii physician and community advocates. And as you know, in the fall, HMA performed a member assessment and we published our legislative priorities. I want to remind you of our focus, that we're honing down to our core objectives. And as you can see, we were working on measures that can reduce barriers to healthcare access and address the critical Hawaii physician shortage. Behavioral health and telehealth, also extremely important areas. All of these overlapping with screening, preventative services, and maintenance of quality care. So we can jump right in and I will review some highlights from this 2023 session. Linda, please feel free to add your comments and perspective on these or any of the bills coming up. SB 397 SD2 HD1 would appropriate funds to increase Medicaid payments to eligible healthcare providers in the state up to 100% of the current Medicare fee schedule rates. Very interesting how this bill moved through its committees, through Senate Health Committee with Buenaventura and Aquino, then House with Mizuno, with Health Della Albalati, and Finance Representative Yamashita, and then on to Conference Committee. Ultimately, the funds for $30 million have been inserted into the annual budget, which was voted on today. Matching federal funds would be about $43 million. And this translates to about 40% increase in reimbursements. You know, we're excited as this bill will encourage physician participation and hopefully improve service delivery for presently about 465,000 people in Hawaii who are covered by Medicaid. SB 62 SD2 HD1. This measure would appropriate funds to the John A. Burns School of Medicine for graduate medical education and training programs to create more residencies and training opportunities on the neighbor islands for medical students. It would also increase training opportunities in partnership with the U.S. Department of Veteran Affairs. As you guys all know, Hawaii has a state physician shortage. The recent count being 776 full-time equivalents based on the most recent Hawaii Physician Workforce Assessment Project. And that deficit is 44 FTEs greater than in the last year's report. And by county, the physician shortages are most critical on the neighbor islands. So HMA has strongly and consistently supported appropriation of funding to create additional residency programs and training opportunities. Over 50% of physicians who complete their residency training in Hawaii will stay to practice locally. This number increases further when students also complete medical school in Hawaii. So it is really vital that Hawaii have an adequate training physician workforce to someday deliver medical care here, practicing in our state, particularly in the underserved areas on our neighbor islands. So our Public Policy Committee really assesses all the bills that are related to access and health equity. And we look at all of these expanding incentives that will help to recruit and retain physicians. We know that the healthcare workforce challenges of Hawaii are complex problems, and they require more than one policy solution. Number 164 appropriates funds for the Hawaii State Loan Repayment Program administered through JAPSIM, with matching federal funds through the National Health Services Corps. The loan repayment program here in Hawaii has supported about 67 recipients in exchange for work commitments in underserved geographic practice areas in Hawaii. And about 80% of those will remain in Hawaii, 61% remaining at the site where they perform their service. In the end, our policymakers put this into our state budget to allocate $10 million in 2024 and $20 million in 2025 for loan repayment. That includes doctors, therapists, nurses, and this is wonderful news. We do greatly appreciate the helpful guidance of our UH colleagues on the medical education measures, particularly Dr. Kelly Withy, the director of the Hawaii and Pacific Basin Area Health Education Center, and the legislative team of UH, including Dr. Lee Buenconseolum, the dean of the UH JABSM. SB 674 would adopt the Interstate Medical Licensure Compact to create a comprehensive process that complements the existing licensing and regulatory authority of state medical boards, and it provides a streamlined process that allows physicians to become licensed in multiple states. This measure requires the Department of Commerce and Consumer Affairs to adopt rules to implement and administer the compact. The IMLC includes presently 37 states, DC and Guam, and it is supported by the American Medical Association. Tons of support in our state on this measure that included HMA, HPH and Queens, UH, the carriers, HAH, HPCA, so many of the stakeholders support this. And it's an important factor in addressing our physician shortage, not just as it relates to telehealth, but also in improving efficiency to the licensure pathway for physicians so that they can physically provide services here in our state, be the boots on the ground that we need in all medical fields and specialties. I believe that this will definitely improve collaborative care, and physicians can really consult across state lines in a substantive way. You're not just curbside consulting or calling your specialty buddy here or there. And the last on my short list of highlight bills, and certainly we can talk about all or any more of the bills that you like, but the last one on my short list is certainly one I think a lot of people may want to discuss, SB1, SD2 for reproductive health services, physician assistance, abortion, and consent for minors. You know, before we open the floor to further comments on questions, I wanted to talk about SB1. This is a complex measure, and it incorporates provider protection language that prohibits the state from penalizing, prosecuting, or otherwise taking adverse action based on pregnancy outcomes or aiding or assisting a pregnant individual with accessing reproductive health services. HMA greatly appreciates the guidance of Hawaii ACOG physician advocates, Dr. Rennie Sooner, Dr. Angel Willie, and our own Dr. Cindy Goto. We strongly support this measure that reiterated state policy and provides protections for physicians who meet their ethical duties to patients' health and well-being while following clinical guidelines and complying with state regulations. And that's my short list of highlights. I want to say that in conclusion, this 2023 session has been a positive and productive legislative session. We're grateful to all our lawmakers for their hard work for Hawaii healthcare. I also want to thank our HMA executive leaders, including President Dr. Angela Pratt, immediate past President Dr. Michael Champion, Dr. Tom Kosasa, Dr. Nadine Tensali for their teamwork in keeping our legislative work a high priority. We're also blessed to have officers that are so committed to our HMA goals, as well as our excellent executive director, Mark Alexander. I'm so grateful also for the engagement of our patient-centered groups like Community First Hawaii, as well as our physician advocates for ACOG chapter, HPMA, AONK, HRS, and JABSM. Mahalo nui loa to all of you for your representation, your education, and commitment to improving health in Hawaii. With that, I will further open up or get maybe some comments from Linda on any of these specific bills. There's so many bills that we worked on. I'm happy to discuss any ones that our attendees may want to talk about.
I just kind of want to mention that today was the last day, and a good many of these measures only passed today. So of all of the bills that were mentioned earlier by Dr. Ignacio, they all have either passed both houses, the House and Senate, and are going up to governor for a signature made into an act, or those that have money implications have been incorporated into the budget. So all of the bills that she listed as her priorities have passed or are being funded, and that's absolutely key. This year we went into the legislative session with an overage, which people thought, well, we had a lot of money, so we can do a lot of things, but there are a lot of needs in the state. So to be able to come out of session with some of our key priorities actually funded is quite an accomplishment, because there were a number of needs that were identified and a number of people who were pushing and advocating that those needs be funded. So I thought, quite frankly, we did very well this session. I think it's important that you note that this relatively short list is a lot of work, there was a lot of work that went into this relatively short list. Because when we started out, we had a couple hundred bills that we were looking at. And as it whittled through the process, it went down to the real key priorities. And it was an unusual year this year. We had a lot of new members, as we mentioned earlier in our conversations. So there were a lot of people learning the process and trying to figure out how the process works and how they provide input into that process with new people. So therefore, and we have a new governor, along with the new directors in all of the departments. All of those things together made it a very unusual session, and one that took a little bit more work than normal. So to come out with this kind of success speaks well for the organization. I will say that of the organizations that I have lobbied for and worked for and through the years, it's probably the better organized among those. Always submitted testimony on time. And I think it's very important that the testimony given, when given in person, was done by a physician. I think that is absolutely key in representing this organization. I rarely testify for any of my clients. I believe, and I strongly believe, that it is important that the testifier be someone with an expertise that can answer questions if asked. And while I could repeat the answers to the questions, I could not in any way say that I had that expertise. So thank you very much for the support of all of the doctors that participated, because that's a tremendous amount of work. That's about all that I have, unless there's questions that I'd be happy to answer.
So what I would mention right now is I put a hyperlink in there in the chat for those who are members of HMA. If you click on this hyperlink, you can log into our website and you'll get an update of the latest status on the various bills, because things were pretty fast moving, and I won't go into detail on it, but it has the links so that you can find out which bills have actually passed, which ones have gone to the governor, which one the governor has actually signed. And for those that are nerdy, you can get into the budget worksheets too, which are going to be important, because a lot of these bills, like for example, SB 164 on the loan repayment program, all that money is identified in both the committee report as well as in the worksheets. Now, the final worksheets haven't been issued yet, but that's how we'll verify, all of that. So this is kind of all available on the website with the appropriate hyperlinks. And we did have a couple questions that came in.
Let me add something
Sure.
before you continue. The session, while the session itself is over, the process is not. So it's good to keep in mind that all of these measures, while passed by both the House and the Senate, now go to the governor. In the governor's office, it is then referred to the appropriate departments for review, and it's referred to the AG's office for legal review. If along the way, anything is raised and compelling reasons are given, the governor has an appropriate amount of time, and I don't have that date, but it is on the legislative timetable, wherein he has to let the legislature know that he intends to veto, and he can veto. you might note that today, at the end of the legislative session, the governor had signed one bill into law, and his veto was overridden, which is somewhat monumental because I don't think I remember a veto being overridden on the last day of session ever, because usually vetoes don't come down until a bit later in the process. So this is interesting. But just to keep in mind that you need to keep an eye on all these bills that have been passed to make sure that it has still continued support from the medical community as it goes through the rest of the process.
So that's why it'll be important for us to keep track. And again, we'll be doing that on our website, and we'll make sure we follow things all the way through. And then also for some of the major bills, the governor may have a public signing, and some of those we've been present at. And we'll again keep our membership informed. One question that came in to just get us going is Dr. Shirasu asked whether Dr. Fink got confirmed as director of the Department of Health, and the answer is yes, he did. And comment from Dr. Nakatsuka, the Medicaid increase in reimbursement is huge. Yes, it is. And there was a lot of people, there were a lot of people involved in that. Healthcare Association of Hawaii, obviously the governor was pushing it, and many of the hospital systems and private payers. So it really is a big deal. And again, Dr. Shirasu has a comment here, perhaps a question. At the last HMA CME program, Dr. Nakatsuka mentioned that there was a proposal to amend the medical aid in dying bill to permit APRNs to initiate the process in addition to physicians to increase access. Any update on that? Dr. Ignacio, I'll turn that one over to you.
So that is in reference to Bill HB 650 HD 2SD1. And that was the one that is, our care, our choice, medical aid in dying. It did move forward. It went to the governor on April 28th, and it did move forward in terms of expansion to APRNs. And there was also the consideration for waiving the waiting period for terminally ill patients.
Yeah, there are other questions on specific legislation that people are interested in. I don't know if you have any questions from here on index cards. Let me go ahead and while we're waiting for some of those, specifically with you, Linda, since you've been doing this for many, many years, I think there were 18 new members in the House,
Yes.
Something like that, and 6 new senators.
Two.
Oh, just 2.
One new senator to increase the number of senators to the Republicans.
Oh, okay.
Oh, I'm sorry, you're including all new.
Yeah, all new.
I'm
Yeah.
sorry, yes, there was
Right.
6. But everyone actually, their senators that were new came up from another legislature.
Right, from like the House, Senator
or
Aquino was on.
council or something like
Yeah,
that. So they've
yeah.
been in the governmental arena, legislative arena, so to speak, but they are new to the Senate.
So I know you're not going to give us anything inappropriate here, of course, but I am curious, were there any surprises that you care to share?
No, I thought that we met with all of the new legislators. I thought they were all very thoughtful in what they had to say. Very diverse points of view, particularly among the newer Republican members. There are some ongoing issues among the caucuses that hopefully during the interim will be resolved. There's always those kinds of things when different and variant personalities are involved and people who have very strong views on very specific issues. So that's not unusual. So no, I think actually with a new governor, and in spite of having 3 of his nominees, his directors being rejected, it went well. I think it corrected itself well. I mean, this is the most of the directors that's ever been rejected, so to speak. And as a result of that, in some of those positions, the governor will likely appoint an interim person that will then come up for confirmation next year. That is somewhat unusual, that the way this all occurred. On some of those confirmations, they were handled rather late in the session, and therefore there was not sufficient time to appoint a new person within the deadline that is given to appoint. So therefore, new names will come up after session. But that, the plus on that is that person is given a whole year essentially to work in the position and gain the knowledge of the department and of the position, so that when they come before the Senate for confirmation next year, they should be well versed in that position.
Do you think there's a chance there'll be a special session at all, interim, this time?
There hasn't been anything that I'm aware of that they didn't address that would require a special session. Even when last year the court ruled on something that was very critical that could have required a special session in order for them to rectify that decision, they did not call one. There were other circumstances. It was an election year and there was a lot of other things going on, but they are very hesitant to call special sessions. One is the cost factor, bringing everybody back in for just a short period of time on a very specific issue. So unless there's some emergency that comes up, a disaster, for example, you might recall a few years back, I think there was a special session to provide monies for the volcano action on the Big Island. Some emergency of that nature would require a special session, but not otherwise.
Thank you. Also, someone reminded me, you should mention, of course, Dr. Ignacio was appointed to the Hawaii Medical Board. She did go through the Senate confirmation. So congratulations again, Dr. Ignacio. We have a couple HMA members that are on the board now. So that's great. And then Dr. Shirasu said, what is the latest on telephone and telehealth visits being reimbursed by HMSA and state Medicaid? Dr. Ignacio.
So there was the bill related to that is 907, HB 907. And that one had to do with, I can't remember the precise wording, and that had to do with better defining interactive telecommunication interactions. And the bottom line is, I think that the trend is moving towards parity, but I can't recall the precise wording. Actually, I'd have to look up what was the final form. I can look it up right now. Let's see. So, no, that's not the one.
I can pull it up here. It passed today, yeah.
So 907 had been about allowing for the reimbursement of services through telehealth via interactive telecommunication systems, two-way, real-time, audio-only communications. I'm just reading it from the screen in certain circumstances. And so that conversation continues to move forward. And we're also really happy because at the federal level, that conversation continues to evolve. Now, I don't know that every carrier is going to reimburse the way that we want them to for audio only. I feel like those, professionally, from my standpoint in the telemedicine that I do, that they can be valuable and important part of maintenance of care and a way for people to access care who don't have broadband access, who may not have the sophisticated smartphones or be able to pay those really high smartphone bills. So I think it is important. I think HMA understands that the telehealth will continue to advance. But in terms of the dollar reimbursements, I'd have to look at the fine print on this bill.
I think the key component, if I remember correctly, was that it addressed the mental health issues and the ability to get reimbursement for mental health consultations that are via telephone. I think that was what was lauded today on the floor in some of the speeches.
Agree. Thanks, Mark, for scrolling through that. That's helpful. So yes, behavioral health and integration was an important part of of that. And it's also an important part of our priorities that we had identified in the fall in preparation for this, that we were going to go with a multifaceted approach in how to address physician shortage. And so definitely the real-time audio communications aspect of it, I think it's going to continue to be really important. I hope I answered your question, Dr. Shirasu. And sometimes I'm like searching for the chat and seeing like if there are other questions, but in answer to, I wanted to jump in on what Mark was asking, like what were some surprises? And I guess I was very excited that the 397 was integrated into the budget. And I didn't know that that was a different way of approaching that policy problem. I hadn't seen that before, but I mean, obviously, you know, that's how they approached it. Do you think that, does that mean when it's incorporated into our budget, there's a question for Linda, that next year it will be reconsidered again, or will we go through the same process policy-wise?
I haven't not looked at the budget specifically. The only thing you need to look at is whether there was money provided in each biennium of the year.
That one there was.
And if there was, then it wouldn't be, unless there was a movement because you needed more money, in which case they would include that in the supplemental budget for next year. But otherwise, they normally do not go back. I mean, they set the budget this year, and that is the budget.
And, you know, it's a good reminder that we are in a biennial system. So the session, in some way, it continues, you know, part two, if you will, is next year.
All of the bills that were introduced this year that did not make it to the end are still alive. Now, most times, the new bills are introduced for next year, and the new bills are what they use to travel through the process next year. But they can technically pick up from wherever the bill left off this year and take it from there. So technically, if a bill made it all the way to conference, but for whatever reason they didn't come to agreement in conference, they could go right back into conference, come to agreement, and pass it out. It's a rare happening, but it does occur and has occurred.
It was explained to me around the Medicaid reimbursement bill that it was an intentional strategy to introduce both the bill while advocating for a budget line item. And the reason for that was to build support for that because it had been attempted before but failed. And so now we go from being, I think, like bottom in terms of Medicaid reimbursement to top 5 state. In fact, Representative Yamashita mentioned today in his speech, the chair of the Finance Committee mentioned first and foremost Medicaid reimbursement. He was very proud of that and mentioned that statistic.
And it's a good strategy, just to add, if you can do it that way, because then you see what the support is in the community and you see what needs to be addressed relative to the specific issue. And then you have the support coming in the budget with the actual monetary amount. And so when you have the Finance and the Ways and Means chair on board in that fashion, I mean, it helps a lot because those are always the stumbling blocks, it's the money.
So a question that came in is, when should we start working on new bills for next year?
I always tell people, I mean, people are already working on new bills for next year realistically, but I don't believe in rushing the legislators after session. They're exhausted. Everybody wants to leave, spend time with their families, and address the other issues that they have not been able to address over the last few months. They've been completely tied up. So I usually will start looking for meetings to look at what possibilities are in the early fall. And I will try to, if we're introducing something, I will have it drafted or starting to be drafted by, say, November, December, in that time period. For a lot of the legislators, they do work year round and they're looking at ideas, so you can introduce those ideas throughout the year. for some of them, they just do not address anything until we get closer to the session. Because they spend that time in their communities, working with their communities and finding out what it is that the community wants addressed, which is an important function as being a representative or senator. So I think it's a good idea if people have ideas of what they'd like introduced to kind of put it together in some cohesive form, so you know, and if there's research to be done, it's always good to get the research done. But really, we wouldn't start talking to people about it until I would say the earliest is September, October. We should, however, I do want to say that we were very lucky. I don't want to say lucky is the wrong word, but fortunate to have excellent healthcare, health committee chairs and consumer protection chairs. Not only were they very thoughtful in what they put forward, they had their own agendas, which they prioritized. They were very focused in what they were prioritizing. And they even reached out for help when they needed help on specific areas of interest where we had that expertise. And that's exactly where we would like to.
So another question for you, Linda, a legal type question from Dr. Shirasu. Is HMSA a nonprofit that gets some tax break in Hawaii? And if so, is it legal to pay huge sums to board members and executives?
Oh, yes, they are a nonprofit. And if you read this morning's editorial piece, it pretty much lays out the whole case about whether or not they should or should not be a nonprofit. So I would not even care to comment on where that should go. Others will take that, you know, and do something with it, I'm sure.
Okay, fair enough. Dr. Ignacio, I know you work with a number of different groups on the continent as well as locally. Have you heard any thoughts from them, any particular concerns that they have had, that they've raised, or anything that particularly impressed you during this session?
Thanks for the question. That's a really good one, that we always try to stay connected with, you know, what's happening at the federal level, as well as what about our organizations, our national organizations. We continue to see a lot of policy questions about scope in different areas, specifically for, you know, expansion into specialties. There was, interestingly, a measure that was moving through Puerto Rico that would allow people who had had primary care experience, say something like, it was some arbitrary number, like 8 or 10 years doing ER, but had primary care, that they would automatically be certified as a specialty in the geographic regions of Puerto Rico. And they were really trying to address similar problems that we have here in Hawaii about a provider shortage, a physician shortage. But it's an awful way to do it, to just say, okay, you've got 10 years experience doing a little bit of surgery, so now you're a surgeon. Or you've got 10 years experience delivering babies, so now you're an OBGYN. That is wildly inappropriate and not good in terms of maintaining safety and quality. So a ton of our national organizations all jumped on that, and they were like, listen, this needs to stop here. We need to address the physician shortage in different ways. But scope expansion to try to cure the physician shortage is not necessarily the best answer. Integrating definitely is. Making sure that we have substantial physician-led teams, I think, is a term that a lot of people use. But in terms of maintaining safety and quality, that we have the people who are trained and certified to do the things, practicing up to the very best that they can in their certification and board specialty. So that's something that continues to come on the national level. We did get, you know, I have had great comments from stakeholders looking at Hawaii who are very excited about the Medicaid bill, the 397, and they were excited how that was going to help with underserved communities. I think a lot of states are going to be looking at similar bills.
So another question that came in is, when should we start working on bills that did not pass? For example, what are the next steps specific to acupuncture? Since you mentioned scope, any thoughts there, Dr. Ignacio? Or
Definitely, definitely, and Linda, please jump in with your thoughts as well. But, yes, they have that summer break where, our representatives will take a break and work in their own communities. At the same time, for us in HMA, on the off session, we're going to have to be working on education, making sure that the issues that we think are important, that our physicians as well as our community are educated on them. Because as we've mentioned in other conversations, some of these policies, they take time to mature. You need to be able to educate all the stakeholders involved in terms of problems and different solutions to address them. So I know that we had talked about how we're going to address the access issue, the physician shortage issue, and we're going to be getting together in the off session, HMA is, with other stakeholders to try and come up with some specific recommendations policy-wise that we can work on as we get closer to the legislative session. We're also going to be, we are part of a work group that's reviewing all of the Hawaii regulatory statutes and looking for barriers to access. And then from that, we're going to have some recommendations again that we can bring to the legislature after we've reviewed. There's like 300 of them. I think we're on like number 80 something, and we're hopefully going to be done reviewing all those statutes by August is the goal. So to answer your question, I think there's also for acupuncture, when that bill was moving through, there was a lot of issues with language, and we need to talk about the nuance of the proper vocabulary for providers or for doctor and stuff like that. And we also have to talk about educating people and integrating like boards, making sure the conversations between medical board, acupuncture board, that those things are, that those groups are communicating so that we can come to more of a meeting of minds before the legislative session in terms of some of these policies. Because the bill that was out, there were a lot of problems with it, and there weren't a lot of solutions without just, redlining every single piece of it. And we wanted to help the legislature because they were trying to update some statutes that are 20 years old when it comes to acupuncture. So there's ongoing engagement with their National Organization of Acupuncture Physicians, as well as the non-physician providers, so that we can hopefully, come together in terms of how to keep quality and safety in acupuncture, especially in Hawaii, where there are so many acupuncture providers. So
Let me add that one of the key functions of the interim is to allow people to network and to come together and share their ideas, to come to compromises if possible. Because the legislature would not like nothing better than if you could come to them with a bill or with ideas where all of the stakeholders are on the same page or close to the same page and close to compromise, so that something can be accomplished within the regular legislative session. So there's a lot of the work, it's not with legislators during the interim. The work is within the organization, with other organizations, with the stakeholders, and with the community. And if you've done that homework well, then you will successfully be able to push a bill through in the upcoming legislative session.
our co-chair, Dr. Beth England, couldn't be here tonight, but I would be remiss without mentioning that Dr. England, in terms of being present for a lot of these meetings with stakeholders and for representing us in for live testimony, she has been great, and we're so grateful. Also, I wanted to mention to everyone in attendance to please look at the HMA website for the specific testimony documents that we have posted. There's a link there for them. We work very long and hard on making sure we've researched these things, that we've brought together a diversity of opinion, and that we try our best to represent you guys. So we would love feedback from our attendees, our HMA members on the testimony. We want you to see, the specific language, that has to be pretty precise and deliberate in certain areas, so that you can tell us, great job, or, oh, I didn't quite, agree with the way this was nuanced, or the tone of this specific piece of testimony. So just so you guys know, thanks, Mark, for putting it up there. Yeah, we want you guys to give us some feedback on our testimony. Thank you.
Yeah, related to that, HMA submitted around 70 pieces of testimony. All of our testimony is listed on our website and is available, and you can click on it and you have immediate access to the actual document itself, as well as the key hearings that we were at. And then there are other resources, as I mentioned earlier, that are available. One resource I might want to draw attention to is a new one that we just brought on. Is called Voter Voice. It's a way of engaging membership so that they can engage their elected officials. It's something that is used by the American Medical Association, as well as most medical societies around the country, and even some of our local groups here. So we're asking first that HMA members sign up for it, but actually we can also open it up to physician members in general, and it allows you to communicate directly with your elected officials at the state level and the federal level. And we can send alerts out. So it's a very organized way of doing things. And even on key legislation, if you click into it, you can access kind of the updates and the resource. Of course, whenever I click on it right now, it's not going to get it to me right away. That's usually what happens. So
I'm so excited about this platform. Thank you for mentioning it, Mark. It's very exciting that we can all get together. I want the physicians to feel like they have a voice. A lot of times you can't be present for the hearings. They happen in the middle of the day, in the middle of the afternoon, and everyone's busy working. But please sign up for this platform, because you'll be able to add your voice to the testimony.
Yeah, it's very important that we engage, and we have to do it in a multivalent way, whether it's social media, actual testimony, written testimony, or using something like Voter Voice. Let's see, another question that came, and actually maybe Dr. Ignacio, you could comment, since you've been on the medical board since really January, do you have any observations about the medical board's role in the legislative process and why that's been an important body for you to be a member of?
Well, I'm so excited and still learning as I've started on the Hawaii Medical Board, but it's very interesting to see these experienced and dedicated physicians all get together. They do talk about specific legislative measures and how they relate to, the agency of the Hawaii Medical Board. They represent a diversity of opinion just like our members do. So they go through the same concerns about scope, same concerns about safety that all of our physicians have. So it's a nice little microcosm of opinions on specific bills. And it's also very clear to me that, we need to increase the integration of the different boards together. Sometimes there's not a lot of cross conversations and overlapping healthcare issues. So that's what I'm seeing thus far, that I think that we can probably try to reach out more to our boards. I know that, the boards, everybody has their lane. We have to stay in our specific lane, make sure that we follow the regular, that we are doing what we're supposed to as controlling quality and safety for physicians in Hawaii. But it will be interesting to hopefully watch the evolution. I know that this is something that a lot of the physicians have mentioned to me on the board. There will be an evolution so that we can all be like moving together as healthcare providers with nursing, with the board of pharmacy, with the board of, for the psychology board and such. So I'm still learning, but I think it's very interesting that they do specifically go over measures and submit testimony in certain instances.
A specific question came up about the collaboration between the Hawaii Medical Board and the Hawaii Acupuncture Board. Do you have any observations on that yet?
I reached out to members of the board to try and understand historically how that has gone. I don't think that anyone wants to suppress dialogue, but we have to be careful when we are trying to move some ideas forward, that there can be a conflict. So for example, you know, if you are wanting to change, wanting to propose some policy measures as they were for acupuncture, you would want to bring the stakeholders in, right? You would want to have the boards having a conversation together, but the initiation of that conversation can itself be kind of biased. So you want to make sure that there is a bilateral kind of will to move towards that conversation, rather than just it's a very one-sided press. So I think what we're hoping to accomplish in the off session is that we bring those board leaders together and they can approach the specific problems of language and statutes together. But it is kind of complicated sometimes when I try to sort out, where do these ideas have to originate? Where does a conversation have to start so that it doesn't seem like it's self-serving? Does that make sense?
So as we start to come to a close here, I want to give a few minutes for both Dr. Ignacio and Linda to have the last word. If there are any observations, anything that you'd like to share with our physicians and the community. Dr. Ignacio, will let you start.
Well, I've been very excited through this session because people have reached out to us asking for our thoughts on specific policies and such. And even though lawmakers, I think that's one of the things that Dr. England and I were very excited and surprised about, because we are working very hard to represent our physicians in our states. So I think these are all good signs that we're staying active in the dialogue, that we're helping to move some conversations forward that are important, and that to sustain that, we're going to continue to need our members to be engaged. And I can't stress enough how I really want to encourage every single attendee here and anyone who's going to be looking at this talk in the future to please contact us, participate with us on our committee, and look at our testimony on the website, sign up for Voter Voice. And it's so important that we continue to engage our members, that they feel that they are part of this dialogue, and you help us to, if we can, form some consensus on our policies, because we now have a very good bank of policies that we have listed on our site. So please stay engaged, help us, participate with us. We're very excited that we continue to be involved in the conversations with our policymakers, with all the stakeholders in these complex problems. So thank you.
Thank you very much, Dr. Ignacio.
I think you summed it up quite well. I don't know that I have much more to add. I do think it's important that your members look for opportunities themselves, not just to participate in HMA, but to participate in their communities, to participate with other organizations, to network, so that they bring with them to this organization relationships and networks that can be useful overall. So it's not a one-sided thing. It's really, you always have to be making friends. You always have to be looking at other people's ideas and looking at, can they, or how would we make that work with what we'd like to accomplish? The more people that gets involved, the more diverse that involvement is, the better the outcome will be. And I think that's important to keep on.
Thank you very much. Thank you both very much. As we come to a close, I want to extend a mahalo to everyone joining us for this edition of Conversations at HMA. Again, a special thank you to Dr. Ignacio, Ms. Rosehill, and all of you for participating. We know that you have your choice of evening activities, so thank you for spending some of your time with us. Thank you to those physicians who belong to HMA, for those who would like to join a community committed to physicians, their patients, and community health. Check out our website, HawaiiMedicalAssociation.org. Again, I put Dr. Ignacio's email address in the chat for those who want to make direct contact with her. Mahalo and good evening.